Hi everyone, I'm Dr. Karthikeyan, microsurgical andrologist and urologist at Apollo Hospital, Screams Road, Chennai. In this video, I'm going to talk to you something about prostatitis. Prostatitis is a problem where there is multiple issues related to infection or inflammation in the prostate gland. Here what we see is the man who is coming to us with a suspected diagnosis of prostatitis, how old they will present. They will be usually in the middle age. Their urine flow will not be good. They may have burning sensation in urine. They may have burning sensation in the semen coming out. There may be some rare situations where there is blood in the semen. They may have what is called as perineal pain, that is pain in between the scrotum and the anal canal. So that place is called the perineum, where we pass stools and we pass urine. There is a space in between that is called the perineum. They may also have testicular pain. So what exactly is prostatitis? Prostatitis is a condition where there is an infection or inflammation in the prostate gland. What is the difference between an infection and inflammation? Infection is caused usually by a bacteria. This bacteria may be picked up on an investigation or sometimes it may not be. Whatever, when we see the report, we can make out whether it's an infection. Inflammation is a problem where there is some problem which is inciting an inflammation. Inflammation is a response of the body to a infection or something which is not a normal thing. So here I would like to give the example of a COVID, where in COVID, even though the virus was cleared from the body in some time, it left a great impact on the body. Many people were on ventilators, many people had a lot of problems, lung loss, etc. These were all because of the inflammation, where there was a problem in the inflammation which gave problem to the patient. So what I would like to explain here is this prostatitis can be of two types. One is an infection and second is an inflammation. So our idea is to pick up the cause and to give the right treatment. Next thing, why does this prostatitis occur? Prostatitis can occur because of a problem in the prostate gland where the flow is not good. It may happen in some men who do not pass their semen out at regular intervals, that is a reduced frequency of ejaculation or sex, or those who don't masturbate regularly. And there are some people in whom it has also been identified that just because of stress, this problem can happen. So end of the day, the most important thing, what we would like to understand is what is causing this problem, what is the probable etiology, that is the cause of this issue, what all we can do to identify it, and how all we can treat it. So for this, we also follow what is called the NIH classification, where we group these prostate diseases into 3 or more major groups. I'm not going into the classification, but I'm telling it an overall perspective. It can be an acute problem, that is, suddenly it started, it is an infection in the prostate gland, usually resolves with medicines, the antibiotics, where the antibiotics plus the supportive medicines usually improve the condition. Whereas what we deal as a urologist or an andrologist specifically is chronic prostatitis, which has been there for a long time, which has led the patient to visit multiple doctors, but there is no good cure. The cause is not picked up, the treatment is not complete. Either the problem settles down but again comes back, or it is not settling at all. So this is called a recurrent or a relapsing problem, where there is no complete cure to the patient. So as an andrologist, what we do is we do a detailed history collection. We assess the sexual history, the urinary flow history, whether there is constipation. We also see what is the physical examination findings. Is there any pain in the testis? Is there any pain in the prostate gland? We also look for the urinary flow. We also see whether there is any urinary infection. Is there any infection in the prostate gland itself? We also do something called a semen culture, or more specifically, we do a prostatic massage culture. These are the most important tests which give us a fair idea as to what is the problem and how do we go for treatment. Coming to the treatment, we usually give our patients multiple medications, each one for a variable period of time. We do rely upon some medicines to improve the urine flow, some antibiotics based on the reports, and some specific group of drugs like probiotics, etc. So we also have specific groups of drugs which reduce the pain, which reduce the impact of pain on the patient. And we also give the patient the correct idea as to how he can get rid of this problem. Coming out of the problem is different from getting rid of the problem. Coming out is to just tide over the present situation and to come out of the situation and lead a better quality of life. Getting rid of the situation is to overall escape from this difficult problem to treat prostatitis. We do find almost 80% of the patients getting improved with these treatment options. This condition itself is a chronic prostatitis, that is a long-standing problem. It immediately doesn't go away. Even after taking 2 to 3 weeks of medicine, our patients come back and tell to us there is absolutely no improvement. So what we say to our patients is this condition is chronic. It took so much time to establish in yourself. Therefore, it takes so much time for the problem to go away from the body. So please be patient, please follow the instructions and the specific medications. And we see almost 80 out of 100 patients coming to us getting treated at around say 3 to 6 months, and most of the other patients getting better at around 9 months. So this is in a nutshell what we see in our OPD about prostatitis, and we will go into the greater depths of this problem with some case scenarios in a later date. Thank you for watching this video. If you like it, subscribe and do share with your friends. Thank you.